More than a third of the women in the UK say that they wouldn't seek legal action if something went wrong during their pregnancy or birth. Half of these women say it's because they cannot afford to take legal action. From our perspective, we want every woman to feel supported in instances of poor maternity care. One of the ways we do this is by offering no-win, no-fee agreements in all of our cases. If we don't succeed with your case, it won't cost you a penny. If you or your loved one has experienced poor treatment during pregnancy, birth, or following the birth of your baby, rest assured we'll do everything we can to achieve the best possible outcome.
Working in medical negligence, I often see cases where women are treated poorly during their pregnancy and birth. Pregnancy and childbirth do come with their risks. If something goes wrong because of medical negligence, what is supposed to be a time of joy can become the opposite for expectant mothers. We've seen the lasting impact of negligent care on mothers, babies, and their families. Poor maternity care can lead to both physical and mental injuries, and we'll do everything we can to make sure the right support is given to any woman who needs us.
In recent years, several NHS hospital trusts have come under investigation for the standard of maternity care, and sadly, it's clear that lessons are still being learnt. I've supported women who have been through severe birth injuries and have seen the impact these can have not only on those women themselves, but also their loved ones and on their confidence in any future care. I've come across cases where vital signs have been missed by healthcare professionals during pregnancy, where women weren't fully informed of the risks or options available to them. In my role, patient safety is always priority. It's about women and their families feeling heard, respected, and safe throughout their pregnancy and birth. Every woman deserves to give birth with confidence, knowing that the care she receives is not only of a high standard, but also compassionate, transparent, and empowering. I believe that every woman deserves to give birth with dignity, trust, and confidence in the care she receives.
Medical negligence claims play a crucial role in safeguarding patients against substandard treatment. In the cases I see, particularly where maternity care has been negligent, women and their families are usually seeking to establish the truth, an apology, and to make sure medical professionals learn from their mistakes so that any future harm to other patients can be avoided. Over the last few years, we've gathered data and campaigned to raise awareness of maternity tragedies, including stillbirths and diagnosis of cerebral palsy following negligent treatment during birth. But unfortunately, maternity negligence doesn't stop there. We want to make sure any woman who is thinking about having a baby, who is currently pregnant, or who has recently given birth is empowered to advocate for herself, confident in her medical staff, and able to receive the best care possible. That's why we firmly believe anyone who has received substandard medical care deserves the right legal support and guidance.